Live from the Business RadioX studio inside Renaissance Bank, the bank that specializes in understanding you. It's time for North Fulton Business Radio.
And hello again, everyone. Welcome to another edition of North Fulton Business Radio. I'm John Ray, and folks, we are broadcasting as usual from inside Renaissance Bank in beautiful Alpharetta. And it is beautiful today, beautiful fall day on this first business day of October 2023. If you're looking for a bank that's big enough to handle pretty much any need you can throw at them, but they're small enough to deliver those services in a personal way, I have found that magic combination at Renaissance Bank. If you've been mega banked way too many times where you are now, and if you're at one of those banks, you know what I mean by that, you'll appreciate the personal service at Renaissance and the way they do what they do. I know my clients have. So go to renaissancebank.com and find one of their local offices, some 200 around the Southeast, and give them a call. I think you'll be glad you did. Renaissance Bank, understanding you, member FDIC. And now I want to welcome Stacy Lathrop and Dr. Luke Lathrop, and they are with SmartMED. Good morning.
Good morning. Thanks for having us.
Yeah, thanks for being here. Let's talk about what you're up to at SmartMED. How are you serving folks out there?
Well, it's been a busy morning so far.
Sure.
Already.
Yeah, Mondays are busy.
Yeah.
So, Stacy, you want to take this?
Sure. So, SmartMED Drive-Thru, about a year ago, which was back in 2022, we opened SmartMED Drive-Thru so that we could offer a really convenient and easy way for people to seek medical care. And so for those that enjoyed the experience, enjoyed might be the wrong word, but for those that appreciated the convenience of being able to test for COVID in their car during that COVID testing time,
right.
We decided to bring the same type of medical care to our patients just in general for all of their medical needs. So people can actually drive up just kind of like a Chick-fil-A, but for medical care at their convenience without an appointment and be seen by a physician and treated for most illnesses.
Mm-hmm. Wow. Now that is fascinating, and I can understand where the idea came from. Let's talk about the genesis of this, though. And I guess before COVID, and then how you came up with this idea because of COVID.
Well, a couple of years ago, it started during COVID testing. We
Yep.
had a COVID testing business and saw over 20,000 people.
You had a COVID testing business?
Yes, we did.
Wow.
Yeah.
Okay. So it was all drive-through.
Correct.
Okay.
Yeah. Crazy times back then.
Right.
But, in line, and there were some long lines at times, patients would ask, hey, I'm here to get COVID checked, but can you look at my son's throat, or can you look at their ears, or can you check for flu and things like that? That at the time we weren't credentialed to do. We were strictly COVID testing. So that's where we got the idea. Like, we could probably do other things with this. Yeah.
Also, it's interesting that you mentioned that. So Luke and I have now 4 and 5-year-old children, and back in the beginning stages of COVID, they were, I think it was 7 months and 18 months at that point. And I went to the pediatrician, and because we couldn't go in, the waiting area was closed. They ended up, the pediatrician came to the car and was checking their ears while they're still seated, strapped inside the car with vitals and everything. And it occurred to me then, why are we forcing patients to go into a building when we can come to the car where they're most comfortable? And so, with having the COVID testing business and seeing that it is possible, plus having that experience as a mom, which was amazing, not having to take my kiddos in, started asking Luke, who's an ER physician, is this possible? Can we deliver quality medical care at the car?
So Luke, you were an ER physician where?
At Kennestone in Marietta.
Okay. So you had that urgent care kind of experience there.
Correct.
At Kennestone. And Stacy, talk about your background, because you've got some marketing background along the way, right?
Well, it's certainly not healthcare.
Okay,
so
yeah.
that was very new to me.
Yeah.
I have 17 years for a company that's owned by Cox Enterprises, which Cox Enterprises is an amazing company.
Yeah.
And I had wonderful career there and worked with a bunch of fantastic people. But one thing that I feel like was missing the whole time is I'd always wanted to work for a nonprofit or somehow find myself giving back. And I have to tell you that this experience, especially in the last year, bringing something like this to market has been so personally rewarding, just being able to help so many people that otherwise couldn't receive the care that they needed.
Yeah, that makes a lot of sense. But what's fascinating to me is you did market research through your previous business. I mean, basically the market, you were there literally talking to your future customers, right?
Well, yes.
In a way.
Definitely at the time, because we had so many people coming through. But then additionally, one of my last positions at Cox was with a startup. And so fortunately, I had a lot of experience just doing, like you said, some market research to understand if a new concept could be brought to market. And we sent out surveys through social media and also to the existing 20,000 customer base and just asked questions like, how confident would you be in medical care delivered at the car? You know, what kind of services would you want? What is going to differentiate this from a normal urgent care clinic or from your primary care physician? And we took all of that feedback and we built what we feel like is an amazing model that gives the patient everything that they were looking for that they didn't have before. And so we've just been so blessed by the community and their support and their openness to consider something like this, because prior to COVID, nobody would have ever considered having a doctor actually evaluate you in your vehicle.
Right.
I mean, that just... It sounds bizarre and off the wall. And it's just amazing now. We have parents that bring patients as young as 1, all the way to our oldest patient is 103. And everyone is open now to the idea, which is, it just kind of really shows you how COVID changed the way so many businesses are doing things.
Yeah, that makes perfect sense. And what are you finding right now in terms of the services you're delivering versus what those surveys
You know
said?
what? The one thing, we're able to do almost all services. I would say the one thing that we're not doing that I think people need right now are vaccinations. But I think there's some really wonderful places where they can go, like Walgreens and Publix and CVS, to get those vaccinations. One thing that we've over-delivered on, which I'm really excited about, is just our on-site lab services. So generally when you go to an urgent care or anywhere else, if you have any type of PCR or molecular test done, you're having to wait 1 or 2 days to get those results back.
Right.
We actually invested in the hospital-grade equipment to do all of our own lab testing on site. So everyone receives both antigen and molecular testing back, so PCR testing essentially, in under 45 minutes.
And that was another lesson we learned from COVID testing. You know, we'd hear stories of samples getting lost. You call the lab, you can't get a hold of the lab. Nobody knows where the specimen is. So like we decided, we don't want any of that. We're going to do it all ourselves. We're going to do it right here, and it's going to be right. Yeah.
Wow. Now, let's be clear on the services that you offer, just so our listeners are clear on this. Your primary care or urgent care or both? And just let's define that for everyone too.
Yeah. So I'd say we're both. We're credentialed as a primary care so that we can offer lower copays and it's more affordable for our patients. But we can essentially offer almost all urgent care services. So we can do testing on site. We can do laceration repairs. We can do skin infections, medication administration. We can do all that.
Yeah. And so you exist not to necessarily supplant someone's primary care provider, but to augment that.
Correct. Yeah. More, I'd say as far as primary care, more plugging in the gaps.
Yeah.
So like if, currently it still takes 6 to 8 months to get in with primary care doc. That's what we hear anyway. So, somebody might need their refill for their blood pressure medication, things like that. Or they have, a minor complaint that they just can't wait 6 months for, but they need to see somebody. So that's what we're ideal for.
Mm-hmm. Wow. So when someone, let's talk about kind of the patient experience and how this happens. Because when people think drive-through, they think something immediate, right? And healthcare is by definition not immediate. You've got some work to do in diagnosing and caring for someone. So what happens? Do I have to call ahead of time? Do I get in line at the drive-through and wait? How does it work?
Yeah, just imagine. And, I like to use the analogy of Chick-fil-A. Just imagine Chick-fil-A for medical care. Mm-hmm. You get in line for the drive-thru. There's no reason to schedule an appointment with us. And the process is really easy. Generally, from check-in to check-out is less than 10 minutes.
Oh, wow.
So
how did you do that?
We have
everybody wants to know.
Yes, we have optimized every single piece of the experience. Mm-hmm. So, and it's kind of like a race car. When the pit crew. I mean, as soon as the car pulls in, there's people all around you. We're quickly registering you. Mm-hmm. While one person is registering you, the other person is getting vitals. But what's incredible about this is that even though we're doing this all very quickly and efficiently, everyone feels as though they had their time and the amount of time that they wanted with the doctor.
Right.
And that's probably what I'm most proud of, is that we've been able to maintain the level of quality and actually exceed expectations in that department, while also providing this type of convenience.
Yeah.
So when they pull in, they're seen right away. Starts with the registration process, which we streamlined, but then also the evaluation process. Vitals are being taken, cutting through the paperwork. Mm-hmm. The physician is right there.
So what you can expect is you roll in, literally, you drive on up, whether you have dogs, kids in the car, whoever you want to bring, and you're registered. From there, you pull forward and someone is taking your vitals and asking you about your medical history. Mm-hmm. And then pull forward a bit more, the physician, nurse practitioner, PA comes to the car and immediately does an evaluation. If there's a need for someone to be swabbed for something, at that moment they're swabbed, and then we run into the lab and we already started processing that. But we've already collected your pharmacy and contact information. So as soon as your evaluation is done, you get to leave. And that's the beauty of it, is that you're not sitting around waiting. And so we then start our work on the inside. Mm-hmm. Once we do get that test result back, we can provide a diagnosis. The same physician or nurse practitioner or PA that you saw will call you with the results and the treatment plan and discuss any additional questions that you had.
Oh, wow. That is fascinating. Stacy Lathrop and Luke Lathrop. How's it work? How's it like working together as a married couple?
It's look at us. We're making funny faces at each other right now.
I know it.
I think we've learned a lot about each other. How about I say something very positive? The positive side here is that we both brought something so different to the table.
Yes, obviously,
Luke has an extensive and really impressive medical background, and then I have the business background, and so I cannot do what he does. There's no way. Mm-hmm. And he probably could do what I do, but he'd rather not. And so
I don't think so.
Yeah.
and so, the two of us were able to make this work.
I would say if a marriage can survive a business together, they can survive anything.
That is the truth. I agree with you on that. And but I noticed Luke kept his comments to a minimum, so he doesn't need urgent care. I think that's what. Right. I'm just kidding you.
Send you to the hospital.
Yeah, that's right. That's right.
Blessed and very fortunate.
That's wonderful. That's exciting. So, I mean, this is. I mean, unless you tell me there's a lot of these kind of concepts that I don't know about. I mean, I've never heard of this before. So have you created something that does not exist?
Yeah,
did not exist before you came up with this idea?
We looked everywhere across the country, because trust me, it would have been easier to imitate someone that already had this figured out.
Sure, absolutely.
And we couldn't find anyone doing this. And so we built the entire concept and the process and, the software that we're using, everything from scratch.
Wow.
With the help of an incredible team that we have. And then also our patients just listening to what they want and the community. We couldn't have never have done this without the community support and their involvement.
Yeah, they've been awesome. And as far as the research goes on this, it's brand new, never been done before when we opened in October of last year, I guess a year ago. I made hundreds of phone calls and emails to the Department of Public Health, the Georgia Medical Board, because we're like, can we do this? Can you actually do drive-through medical care? And there were no stipulations saying you couldn't. And that's what they all said, like, well, it doesn't say you can't. So here we are.
So we thought, here, you know what? Let's do it.
Yeah, that's
Let's
great.
Make it happen.
That's terrific. And presumably that given your success so far, the market is speaking that it wants this service. So it's, I would imagine it's going to be a little hard to come back and say, hey, we've got questions about this, right? I mean, from the regulator's point of view.
Oh, yeah. No, it's verified. It's all good.
Yeah. That's good. That's wonderful. So, if I do want to walk in though, I can walk in.
Yes.
Right?
Yes, absolutely. So
or if there's some need for me to come
absolutely.
Inside, right?
So I'd say 95% of the people want to remain in the car because it's so daggone easy. However, of course, you can absolutely walk in. We have evaluation rooms. If we're doing, IV hydration or we're doing a laceration repair or something else, of course, you'll go into a private evaluation room. But we wanted to provide our primary care through the drive.
What you're saying about the taking care of children makes so much sense because I remember, yes, I am still able to remember this. I remember having kids and going to the pediatrician and, there's the well part and the sick part. And that's the biggest fiction in the world, right? Because everybody's all mixed up. And so you don't know who's well, you don't know who's sick. And you know that if your kid's well, they're about to be sick, right?
Nope.
Right.
Yeah. So what you're saying makes so much sense.
I mean, it's actually, it's amazing to see the response from the moms and the parents and also the dads now, because now the dads are just fine with taking the kids in to be seen because it's so easy. I mean, we're remaining on our Zoom calls in some, some aspects. They're on the phone, moms and dads, able to continue with life while they're having their child checked. And they're not... What I noticed with my kids, and maybe they're different than everyone else's, but it seems like every time we go to an airport or a doctor's office, they're licking things, they're on the floor, they're doing all the things they're not supposed to do, only then. And with us, the kids remain inside the car at all times. They're belted in. I mean, it's also really great for kids that are on the spectrum, that aren't comfortable with waiting in doctor's offices. So it's amazing how many pediatric patients that we've treated.
Yeah.
And they all get a toy.
Oh, that's right. Of course.
Oh, wow.
They always want to come back because they always get Hot Wheels or some other awesome toy from us on the way out the door. But we'll actually have parents pull in with 3 and 4 kids that need to be seen. We've even had a bus pull in with 7 children and have gone up into the bus and actually taken care of the children and swabbed the kids while they're right there in the bus and been able to get them out in 22 minutes.
Wow.
So it's really pretty impressive what our amazing team's able to do.
Yeah, a personal SmartMED record, right?
We
7
have
kids in 22 minutes.
Yeah, I know. We like to keep our numbers at top of mind, so we're always trying to, achieve the next step.
Yeah, that's wonderful. So let's talk about this from a 40,000 foot point of view, because we have seen a lot of changes in healthcare. So where do you think this model is going that you're pioneering, and how will it change medicine as we know it?
Well, I think it will be or could be the new normal. People don't like to wait for anything, not medical care or anything. So I think it's so convenient and so accessible that I think, if in the right area, it could be, the new trend in healthcare. Because I tell you, our patients really love it, and it's so convenient. And, we've had to send a few people on where the cases were just too complex. I mean, we can't handle everything. That's, the ER is still there for a reason, right?
Yeah, right.
But yeah, I think it's definitely going to be a new trend.
Yeah, I think what it does is it gives people that don't want to go in somewhere, but yet aren't 100% comfortable with telemed because you're not able to actually do diagnostic testing that well, with telemed.
Yep.
It gives them something in between, something really personal and convenient, and also where that you're being truly physically evaluated by a professional.
Right. Yeah, and I guess thinking about the Chick-fil-A analogy here, how Chick-fil-A is increasingly, I don't know the numbers, but they're increasingly more of a drive-through method of delivery than they are in store, right? So in fact, I think they're testing 100% drive-through locations right now. And that's really what you're getting at here, is that that's really where the demand is based on where customers are, what they're actually doing in the marketplace.
Yeah, I think it'll be interesting to look in 10 years and see what people have done with these large urgent cares and how they've been able to minimize the space down to 1 or 2 evaluation rooms with a drive-through.
Right. Very interesting. So obviously competition's going to come. So how do you continue to distinguish yourself in the marketplace?
I think it's patient experience for us. I mean, I would like for there to be competition because that means there's more opportunity for patients to receive care like we're giving. I mean, we can't serve everyone. But one thing that we do better than anyone else out there is take care of our patients. And if you look at our Google reviews or you look on the social media on the moms networks, and I'm just really thankful that they take the time to share their experience with other people proactively. But they all talk about our heart and they all talk about kindness and really feeling heard and listened to. And I can't tell you how many times it would be surprising for you to see where we've had a patient, we've held their hands or they've teared up and we've teared up. I mean, because they finally feel that someone is actually listening. And it's interesting because you wouldn't think you could get that type of connection with someone in such a quick interaction, but you can, because everyone that we're hiring and our hearts are in the right place and we're genuine. We genuinely want to help people. It's that servant heart.
Well, and there's something a little personal about rolling down your car window. You're really kind of opening your front door in a way, right? I mean, you get a glimpse into someone's life.
Yes. It's so, we have kiddos coming out of the trunk sometimes. It's awesome. The parents will tell them to, get unbuckled, and we'll open up the hatchback on the back, and a couple kiddos will pop out the back, and we're right there in there with them. I mean, we're sitting on the floor mats, holding hands while someone else is swabbing. I mean, we are part of their family. And that's really the really cool thing. And I love being able to see people of all ages, because at this point, we are now seeing 3 generations of families. I mean, that starts with the moms bringing in the kids, then it's the parents themselves. And then all of a sudden, the grandparents come through and they're like, oh, well, my daughter was telling me about you. We love these families that we've gotten to know.
Yeah, that's wonderful. That's wonderful. So we'll get more information here at the end, but I'm sure people are dying to know exactly where you're located. So let's get that out.
Yeah, we are so excited finally to be in our permanent location, which is at 612 Holcomb Bridge Road in Roswell, 30076. It's right at the corner of Holcomb Bridge Road and Alpharetta Highway. And it's adjacent to that Chick-fil-A. Funny, we keep mentioning Chick-fil-A,
That's
but
right.
it's adjacent to the Chick-fil-A, which makes perfect sense. And so, yes, we have a building, but people will just continue, if they want to use the drive-through, to drive around the back where the canopy is.
Yeah, that is awesome. So what's ahead? I mean, what does it look like? I mean, you're getting, and maybe that's an unfair question to ask because you're just so glad you've got your first permanent location open, right? But what does it look like for you? And what do you? I'm sure folks want to know, when are you going to open up in Milton or Alpharetta or Johns Creek, right?
Well, yeah, we're super excited for our permanent location in Roswell, but we do have letters of intent in East Cobb and Woodstock, and we're always on the lookout, and we were looking on the way driving up here.
Yes, we'd love a place in Alpharetta, and we're just excited about what the future holds for us. You know, there's some different investors that have asked us, you know, is there a way we can become involved? And we love to look at those different type of business partnership opportunities and see how we can help one another to get this model out across the state.
Yeah, that's fantastic. Stacy Lathrop and Luke Lathrop, and they are the owners, operators of SmartMED Drive-Thru. Wow, what a wonderful concept and idea, and congratulations on your great work. This is fabulous. I know.
You.
Yeah,
Thank
the market's
you.
obviously speaking.
Thank you so much for having us and helping us tell more people.
Yeah, absolutely. Let's get to the most important question, though, let's reiterate where you're located, and also if folks want to know more before they come drive through.
Sure. So again, we're located at 612 Holcomb Bridge Road in Roswell, 30076 at the corner of Alpharetta Highway and Holcomb Bridge Road. And our phone number is 678-744-5386. And you can always go visit us on the website, which is www.smartmeddrive-thru.com. And also, if you're curious to know what the wait time is, you can just check the top of the website. We always have it listed there.
And we're in network with all major insurance carriers.
Yeah, I think that's important to share. Yes, because that seems to be a big question.
That. Yeah, thank you for that, because I'm sure there were some listeners out there like, John, why didn't you ask that question? But you're in all major networks.
Yes. So whether it's Aetna, Blue Cross Blue Shield, United Healthcare, Humana, Cigna, Medicare, Medicaid, CareSource, AmeriGroup, they all consider us in network.
Perfect. Great work here, folks, from Stacy and Luke Lathrop with SmartMED Drive-Thru, right?
Yes, sir.
Wow.
Thank you so much.
Thank you so much. And congratulations on your great work and the work you're doing to serve so many folks in this North Fulton area.
Thank you.
Oh, that's what makes us the happiest, is helping the community.
Yeah.
For sure.
Thank you. Hey, folks, just a quick thought for you. If you're a business owner that you've got your own illnesses in your business and you need someone to kind of drive through, get those illnesses taken care of and drive on, I've got an idea for you. It's the great team at Office Angels. They have a whole team of angels that fly in and get those administrative tasks done, or bookkeeping or other issues that you don't need to be spending time on as a business owner. You need someone else to do that work for you. They do fantastic work, and I know this myself because I use their services myself, and I couldn't run my business without them. Here's what I suggest you do. If you're shy, just go to officeangels.us and check them out, but I suggest you just call them 678-528-0500. Tell them I sent you and explain what your problem is, and they will figure out a way to help you, support you in your business growth, take care of those back office problems, and restore the joy to your business. And just a quick reminder, I've got a book coming out later this year. It's called The Generosity Mindset Method for Business Success. Raise your confidence, your value, and your prices. And this book is going to be available in December 2023. If you want to know more about that, you can go to thegenerositymindset.com and learn more. Sign up for updates on release date and that kind of thing. And I also want to thank you, our listeners. You have supported us for now 7.5 years, and we just passed show number 700 thanks to your support, and we're so grateful for that. You have shared the show when you have heard business leaders that are doing great work, and that work deserves to be found, and I can't imagine there aren't some reasons why you wouldn't want to share this one with others that you know that need the services that Luke and Stacy are talking about with their business. So continue to help us in that way, and also follow us on social media. Continue to share us on social media. That's how we get the word out on the great business leaders that we feature here on North Fulton Business Radio as we live into our mission to be the voice of business in the North Fulton region. So for my guest, Luke Lathrop, Stacy Lathrop, I'm John Ray. Join us next time here on North Fulton Business Radio.